Welcome, everyone, to the Full Spectrum series. My name is Nick Valentino. I am an assistant director in the Hajim School of Engineering and Applied Sciences, and I'll be your host for this series. This is the third year of the Full Spectrum series, where we invite faculty to discuss and explain their fields in an effort to inform and educate prospective and current students, parents, and alum on the problems engineers and computer scientists are trying to solve. So if you're watching this and you're interested in learning more about problem solving and engineering, you're in the right place. Our guest today is Dr. Mark Buckley. Dr. Buckley earned his PhD in physics from Cornell University. He is an associate professor of biomedical engineering. He's also on the BME Diversity and Inclusion Committee, is a faculty advisor for the student chapter of the National Society of Black Engineers, or NSBE, and has been actively involved in the Upward Bound program for many years. So, Professor Buckley, as I just stated, you have a lot going on. Thank you for being here. BME is one of the larger departments, and it's a very popular major. So I understand the busyness of your schedule. So thank you for being here.
And thanks for inviting me, Nick. It's a pleasure.
Great. So can you give us an overview of biomedical engineering, or BME as we often refer to it here?
Sure, I'd be happy to. Let me just share my screen. Okay, so I'm really excited to give this presentation today, defining what biomedical engineering is and hopefully getting people excited about the field. But before defining biomedical engineering, let me start by offering a definition of engineering itself. We can define engineering as the application of science and math to solve real-world problems, often by designing and building structures and machines. So all engineers use math and science to solve problems. What then do biomedical engineers do? Well, biomedical engineering, or BME, is one of the many subfields of engineering. And biomedical engineers are specifically concerned with solving problems related to healthcare and medicine. In other words, biomedical engineers use math and science to solve health-related problems, often by designing medical devices and instruments. So how is biomedical engineering then similar to other engineering disciplines? Many of you may be familiar with several other branches of engineering, such as mechanical engineering, electrical engineering, civil engineering, and others. You may know that mechanical engineers design and build mechanical systems, electrical engineers design and build electrical systems, civil engineers design and build public infrastructure, and so on. Well, BME actually overlaps with many of these other engineering disciplines quite a bit. For example, some biomedical engineers use the principles of mechanical engineering to design prosthetic limbs for amputees. So we've just talked about the similarities between BME and some other branches of engineering. How then is BME different from these other engineering disciplines? Well, what distinguishes biomedical engineers from other engineers is that, unlike other engineers, we biomedical engineers have to be familiar with biology and medicine in addition to engineering principles. For example, a key skill for many biomedical engineers is to identify unmet medical needs that can be solved using engineering approaches. Now, one really exciting feature of biomedical engineering is that because it's defined by its applications in health and medicine and not by its scientific content, BME is actually extremely broad. So any engineering effort that you can think of is BME as long as the end goal is improving healthcare. And due to this breadth, BME actually can be subdivided into countless subfields, including but not limited to biomechanics, biomedical nanotechnology, tissue engineering, and neuroengineering, among others. One of these subfields, actually the subfield that I specialize in, biomechanics, is concerned with the applications of mechanical engineering in medicine and in healthcare. Another cutting-edge subfield of BME, biomedical nanotechnology, is the use of nanomaterials, or materials with tiny dimensions on the order of just a few nanometers, as diagnostic sensors or other medical devices. Yet another really exciting branch of BME is tissue engineering. So what do tissue engineers do? Tissue engineers expose cells to specific chemical and physical signals in order to grow living tissue outside the body that can then be used to replace injured or diseased tissue in human patients. Finally, neuroengineering is another important subfield of BME, and neuroengineering is concerned with integrating the brain and the nervous system with therapeutic and diagnostic devices. Okay, so who might be interested in BME? What kinds of students are typically interested in BME? Well, if you enjoy science and/or math and are interested in applying science and/or math to improving healthcare for the injured and sick, you might be interested in majoring in BME. You might also be wondering what kinds of jobs BME majors get. Well, as you might imagine, since BME is such a broad field, there's actually a huge range of jobs and careers that BME majors can pursue. One example of a job a BME major may get is as a product engineer at a medical device company who's responsible for conceptualizing and designing new surgical instruments and implants. A BME major could also become a Food and Drug Administration or FDA engineer who's responsible for assessing the safety and efficacy of medical devices. Finally, another example of a career for a BME major is a BME professor like myself, who's responsible for teaching the principles of BME to undergraduate and graduate students and also performing research within the field of BME. So what kind of research do BME professors do? Well, I'm going to end the presentation with just a few vignettes describing some really exciting BME research projects at the University of Rochester. So you're probably familiar with ultrasound. It's a technology that uses sound waves to provide medical professionals with images from within the body of a patient. Dr. Diane Dalecki and Dr. Denise Hawking, two of my colleagues here at the University of Rochester, are working together to figure out how ultrasound can also be used to heal chronic wounds. So it turns out that under specific condition, the acoustic energy that's imparted into the body by an ultrasound probe can help speed up wound repair. And Doctors Dalecki and Hawking are trying to better understand this phenomenon and also are trying to optimize ultrasound-enhanced wound healing in individuals with diabetes and other diseases that are associated with impaired wound repair. Another really exciting BME research project at the University of Rochester is the development of wearable hemodialysis technology in Dr. Jim McGrath's lab, another of my colleagues. When kidney transplantation isn't possible, or when donated kidneys aren't available, individuals with kidney failure have to go to dialysis centers multiple times per week for several hours so that dialysis machines can clean and remove waste from their blood. As an alternative, a wearable or implantable dialysis machine would vastly improve the quality of life for patients needing dialysis. So Dr. McGrath's lab engineers membranes with tiny nanoscale pores of custom sizes that hold a lot of promise to serve as blood filters for wearable dialysis machines. Finally, I'll speak just really briefly about one of the projects in my own lab in the branch of BME known as biomechanics. So while tissue transplantation surgeries are often essential to maintain a patient's health, during these surgeries, surgeons can impart physical forces on transplanted grafts that can cause accidental damage and negatively influence surgical outcomes. So our lab, in collaboration with surgeons who commonly perform transplantation surgeries, is working to determine the types and magnitudes of physical forces that cause the most damage to grafts during tissue transplantation procedures, such as vision-saving corneal transplantation surgery. Using this information, we then develop tools and strategies that avoid application of these damaging forces during surgery. All right, and with that, I want to thank you for watching this presentation. Hopefully it's provided you with a sense of what BME is and how exciting it is to be a biomedical engineer. Happy to answer any questions now, and I encourage everyone to visit the University of Rochester Department of BME website shown on the screen for even more information.
Excellent. Thank you so much for that overview. I think the amount of opportunity within biomedical engineering is so vast. And I want to ask you a few questions sort of about the narrowing down process. We get a lot of students, we get the common application for the student. A lot of them will cite, perhaps a relative that was sick, or that's their first sort of foray into understanding biomedical engineering. When students are approaching in their first and second years, what are some of the reasons why they're getting involved in biomedical engineering?
Yeah, I think a common reason is that students have experience with a sick or injured relative, and really want to make a difference, both for their relative and for any sick or injured individuals to help them. And BME is a great way to do that. I find a lot of BME students are students that are interested in science and math, but they also have a passion for helping people, and maybe that comes from some personal experience.
So in the lab, or in your lab, when you talk about problem solving with math and with physics, what does that look like in terms of because a lot of times the students, their first experience are like, oh, I want to tinker with things, or I want to be able to work with my hands, and we have to, well, listen, the math and the physics come first in some of those cases. So what does it look like in a lab application for use of math and physics as problem solving?
Yeah, so I mean, in my lab, the way we use math and physics is multifaceted. So we're interested, the project that I mentioned, we're interested in analyzing transplantation surgeries and really understanding what kinds of forces are imparted on grafts. And that requires an understanding of Newton laws of physics. It requires some experimental devices, custom experimental devices to be built. So there's a lot of computer software that we use to design devices and then to simulate on a computer some of the physical forces that are imparted into grafts, as well as simulating it experimentally in the lab to just gain a clearer picture of what's happening to grafts during surgery. And I think a lot of BME is like that as well, where the way you use math and science may be different in one lab versus another, but a lot of it is stuff you learn from a course that at the time you learn the course, it may not seem so exciting. But what I love is when students in the lab get to use something that they learned in a course and they weren't sure it was going to be that useful to them, and they get to apply it to this real world situation. And it sort of then has this feedback to makes them more excited about future classes that they take, because they start to realize that the things they're learning in classes actually have really, really important real world applications.
How do you fight the urge to say, I told you so? I mean,
I don't fight it. I just say it. No.
I told you you're going to need this. So it doesn't necessarily have a test, but it is in an application.
Yeah, it's hard though. It requires patience, right? It requires patience because, math and science courses can be hard. They take a lot of hard work, and we all reach the point where it's like, oh, why am I doing this? Why am I spending so much effort? But it really is worth it when you get to the end.
So I still think a lot of incoming students and prospective students, I'd say profession point, right? So we're like, doctor, lawyer, teacher, banker. Like we think of these in terms of with the increase of information about what opportunities are like. Hopefully we're getting better at students having a more of an open mind of what they can do. With that, students will come to biomedical engineering and become in our pre-medical, or fulfilling their pre-medical requirements, right? They're interested in going to medical school. I do know a lot of them stop and they go full force into BME. Why do you think that is?
Well, I mean, I think, first of all, I'll say that I think BME is a great major for pre-medical students, for students who want to go into medical careers, because it's a really valuable perspective to understand the science and engineering behind a lot of the medical devices that you may use in the future as a doctor or a surgeon or other type of medical professional. So I think it's actually really valuable and great major for future doctors and future medical professionals. But I do see what you're referring to, which is a lot of students initially do it as sort of a pre-med major and then end up staying in it. And I think it's because they find that they really can have an impact in BME. Obviously, you can have a really important impact on helping individuals if you're a doctor, but BME is just an alternative way of doing it. And I think a lot of students who want to be doctors want to do it because they want to help people. And if they're just using BME as sort of a starting point on their path towards being a doctor, maybe they find that there's alternative ways to make a difference.
I have found that especially in the last 10 years, I think the students have become more global minded. And
Right.
they come here and they want to be successful, but they also want to save the world, right? What sort of experience have you had with students in terms of their interests and the idea of being able to use BME on a more global level?
Right. I think that's something I'm seeing more and more of, and it's so exciting to see. We have students who come into our program and really what they have a specific application in mind. They're thinking of specific healthcare needs, maybe of a specific country that they have experience with in some way, and they want to be able to make a difference, coming up with low-cost solutions, and that's sort of their end goal. And it's really exciting because we've seen students really get to the point where they really continue to follow this path, and they have startup companies geared towards developing technologies that are low cost, that can be applied sort of in any setting. And students really stick with these passions. But I think it's really, from my perspective, it's great to see students coming in with such specific goals and that sort of gives them this extra boost of excitement as they're going through the coursework, because they know the point they want to reach in the end.
One of the things you said that I didn't realize before I started working with engineers and engineering students, is the idea of a cheaper method, right? Being able to bring the cost down on something is such a valuable part. Like, we have solutions, but they're so unbelievably costly, we can't replicate them at a larger scale. What do you think is the biggest misconception about BME that people will have? The thing that you find dispelling any myths or rumors about that? What do you think about the biggest misconception is?
Well, I think there's lots I could.
That's good.
I think one misconception that I've heard a lot about BME is that in BME you learn a little bit about a lot of things and not a lot about anything, and I think that's not the case. I think like in our program we have these things we call concentrations, and so students can kind of focus in and gain a really in-depth understanding of a specific subfield. Some of them are actually analogous. Some of these concentrations are analogous to the subfields that I described in the presentation. So they can dive really deep into one subfield of BME and become a real expert in that. And I think it's sort of one of the repercussions of this misconception is that students then think if they major in BME, they can't get a job outside of BME, right? And that's also not true. Is you can major in BME and you become such a versatile and skilled engineer that you can get jobs. And I've seen it. I've seen students major in BME and then decide maybe BME is, maybe they're interested in a broader range of jobs, not just in BME, and they end up getting jobs as mechanical engineers, sort of not in companies not even working towards health and medical related problem solving. So I think maybe that used to be the case, but it's really not anymore. I think BMEs really get a very deep, it is a broad education, but also a deep and specific education, a specific subfield, and become really versatile and can work in almost any engineering field.
Yeah, I mean, breaking it down to the idea of being a skilled problem solver, I think has been the most consistent throughout all the majors. I was in Duncan Moore in optics' office, and I look to the back, and in the corner, he's got a picture of him and President Clinton and then two other people. And I was like, "Oh, you met the president?" Well, I worked in the White House for 2 years. And I said, "On like science related things?" He said, "No." He said, "It started science related, but then it became everything." And it's the idea of like large scale problem solving. I think is not necessarily something that an 18-year-old will necessarily think that is sustainable. They'll think it has to be a specific profession they have to apply to, and not necessarily learning these general set of skills. Do you
Right.
think your abilities, like, how has your ability to solve problems changed since you've become faculty?
Yeah, I mean, I think it's improved vastly, and it sort of translates to other facets of life, not just in work. I mean, it's, learning to sort of look at a problem, step back, think about the problem, develop a hypothesis, develop a smart approach before you jump into anything. I mean, these are lessons that translate to any profession, and it's one of the reasons the BMEs are sought after, again, even outside of engineering. But it translates to other parts of my life. Like I hearken back to the scientific method and the approaches we use in the lab when I'm confronted with a new situation, even outside of work.
I wish I had that discipline. I usually go right to the problem, make it worse, and then have to call somebody for it.
Well, I do that too, but I'm getting better.
There's hope. There's hope. That's good. Right. So, as a lot of the people who watch us are prospective students and parents of prospective students, I wanted to ask a little bit more questions about you and how you got here. I want you to sort of think back of you in your senior year of high school. Like, did you see yourself becoming a professor? Did you see, what would surprise 18-year-old you the most about yourself now?
Yeah, honestly, so when I was 18, and this is just my personal story, I guess. When I was 18, I love science and I love math. But I honestly, this is a little embarrassing, but I don't even think I really knew what an engineer was. I actually used to think that, like, the subjects you learn in high school, which, there's, at least in my high school, there wasn't engineering. I think most high schools are still like that. Like you don't usually take engineering until you're in college. But like the subjects are like your jobs, right? Like they all, of course, if English, you can be a writer, or you can, so physics was the science that I took that I really enjoyed. So I knew I wanted to do something related to math or science, but engineering never even occurred to me. So I just decided I'm going to be a physicist, just because that was my favorite science subject, my favorite subject that I took. So I was like, okay, I'm going to pursue a career as a physicist. So I actually I majored in physics in college, and then actually got my PhD in physics even. And it wasn't until grad school that I was exposed to biomedical engineering and realized, like, hey, I actually like this a lot more, because for me personally, it was the application of helping people, contributing to new technologies that advance the field of medicine and improve care for people who are sick and injured. And just getting exposed to that later, like it was pretty late in the process I got exposed, but fortunately it wasn't too late, and I kind of switched fields. But I think when I was in high school, I didn't, being a professor, it never occurred. I want to do physics, whatever that entails. So I guess maybe I wouldn't be surprised that I'm in a career where I get to do math and science, but the specific career, I mean, I think I would have said, what's a biomedical engineer? If you, if you sort of looked into a crystal ball and told me when I was in high school what I'd end up doing.
How can you talk more about that uncertainty and how it felt? I mean, because when, like, I guess it ties to the question of, like, when did you know that you were going to apply for an advanced degree during college?
Right. So it just, I went into college, and then I was like, I like physics. And then somebody told me, well, if you want to do physics, you need to get a graduate degree. So I worked as hard as I could towards that end, just because I was told that that's sort of what you needed to do. But again, like it's not anything I'd really thought of in high school, like what, are you going to need to go to school for all these years and things like that. So it probably helped that I didn't have too long to think about it. I just kind of jumped into it. But I think it in a sense, that's sort of a lesson too, is that you can adapt and change. And I think it's never too late. It's never too late. So even if you're a student and you end up thinking you want to follow one path and you want to change your mind, it's always okay. You can find out about something. You can, you don't have to think of yourself as, right now you need to make a choice that determines what you're going to do the entire rest of your career. always be flexible and always look for other opportunities, and be thinking every time you take a course, is this something that I really enjoy? Is this something I could spend my life doing?
I love that. I think that this perceived pressure to have the world figured out, by your 19th birthday is one of the things that is so taxing on students, because they see other people and they're trying to, college is golf, right? You're playing against the course, right? And
Right.
sometimes you have to shut everybody else out who looks like they have it all figured out, but a lot of times they don't. I wanted to ask you, sort of like going forward, about Ed Hajim talks about this in his commencement speech. The next big wave. What's like the next big thing that you think you could have, either current or prospective students pay attention to, that is happening in BME?
Because BME is so broad, there's so many answers I could give. I'll just give one example of something that I think is super exciting, that really is something that we're going to see in our lifetime kind of change the world in a lot of ways. And that is something, and some people watching this may have heard of it, but it's something that goes by many names, but some people call it organ on a chip or body on a chip systems. So I mentioned tissue engineering, right? And what tissue engineers do is they sort of give specific signals to cells to make them grow different types of tissue. And the initial application of tissue engineering that the folks who developed this technology initially were kind of dreaming of was to use these lab-grown tissues to replace injured or diseased tissue in human patients. But one of the new applications of tissue engineering is, what if instead we grow tissue, put it on a little chip, and actually grow it in a way that we can kind of mass produce, right? So we can have thousands of these things. And then we can use this tissue as a drug screening tool. So you can even grow tissue, and you can grow tissue that has different diseases, either by growing the tissue with cells that are affected by the disease, or by inducing the disease on a chip, and then screen as many known drugs as you can to see what reverses that disease. Even maybe doing this in a patient-specific way. So imagine if you had a patient who had a liver disease or something, and you took a biopsy, you take their cells, you grow tissue in a dish, and then you try different drugs in a dish, so then you know what's going to work in that patient in the real world. This is a really exciting technology. Pharmaceutical companies are getting really excited about it. It's a technology developed by biomedical engineers that I think is really going to lead to incredible discoveries of new drugs and new therapeutic approaches for countless diseases.
Yeah, I mean, that's amazing. And the idea of like having, it's almost like practice material, right?
Exactly.
To do this on a large scale, and then I not have to worry about, working on patients and all the things that go, the human factor out of it to get on it. And that is really exciting.
It's super exciting
before. That's really great. It's got to be exciting when you do have, like you said, the breadth of this field, but then having all of these advancements happening all around you. Like, do you feel like in a not post-COVID, but like post-quarantine world, that we're starting to make headway on some of this?
Oh, we definitely are. I mean, even with the the organ on a chip, body on a chip stuff. I mean, there's I'm looking at some of my colleagues, Jim McGrath and Hania Watt, are working on this technology, among others, Lisa DeLuise and others. And I get to see firsthand some of the progress they make, as well as other colleagues from across the world. And every year I go to a conference. So I don't work on this specific topic, but I go to conferences and see presentations every year. It seems like they're making more and more advances in this direction and in others. And I do feel a lot of the most exciting developments in BME have really been accelerating recently. There's other things I could mention, like exciting wearable technologies. I don't have time to go into all the details, but there's so many exciting technologies, and I see them accelerating, and I think it's a really exciting time to get into BME.
That's great. I appreciate your insight on this and your presentation. At heart, I'm always going to be an advisor, so I really like hearing other people's advice. So my last question, what type of advice would you give somebody who has seen, let's say a prospective student who's just watched this video and then now wants to go out in the world and make this happen? Like, what advice do you have for the next steps?
I guess it sort of harkens back to one of the things we were talking about before. Like in BME, I think if you're excited about BME, please join us but be a little bit patient, right? Because the thing about BME is there's a lot of sort of coursework you need to get under your belt before you get into the exciting stuff. So I don't want a student to come to BME, off the bat, you're not going to be making organ on a chips, right? You need to get there. And I think you need even more patience than in some other fields, because there are so many basic courses you need to take: biochemistry, physics. But it's worth the wait. So be patient, maintain that passion you have, and stick with it. And I can't wait to see what you accomplish in the future.
Excellent. Oh, that's really great. Well, Dr. Buckley, thank you so much for your insight and spending time with us. We really appreciate it. I think it's going to be very helpful for people seeing this.
Thanks so much, Nick.
So the full spectrum series will return with other areas such as electrical and computer engineering and computer science and much more. So please feel free to share this video on behalf of the Hajim School. Thank you for watching, and we hope to see you soon.